Sleep apnea is a sleep disorder characterized by abnormal pauses in breathing or instances of abnormally low breathing during sleep. Each pause in breathing, called an apnea, can last from a few seconds to minutes and may occur 5 to 30 times or more an hour. Similarly, each abnormally low breathing event is called a hypopnea. Sleep apnea is diagnosed with an overnight sleep test called a polysomnogram or sleep study. There are 3 forms of sleep apnea: central, CSA, obstructive, OSA, and complex or mixed sleep apnea, constituting 0.4%, 84% and 15% of cases respectively. In CSA, breathing is interrupted by a lack of respiratory effort. In OSA, breathing is interrupted by a physical block to airflow despite respiratory effort, and snoring is common. Regardless of type, an individual with sleep apnea is rarely aware of having difficulty breathing, even upon awakening. Sleep apnea is recognized as a problem by others witnessing the individual during episodes, or is suspected because of its effects on the body, sequela. Symptoms may be present for years, or even decades, without identification, during which time the sufferer may become conditioned to the daytime sleepiness and fatigue associated with significant levels of sleep disturbance. Sleep apnea symptoms. Sleep apnea affects not only adults but some children as well. As stated by LAD, patients complain about excessive daytime sleepiness, EDS, and impaired alertness. In other words, common effects of sleep apnea include daytime fatigue, a slower reaction time, and vision problems. Moreover, patients are examined using standard test batteries in order to further identify parts of the brain that are affected by sleep apnea. Tests have shown that certain parts of the brain cause different effects. The executive functioning part of the brain affects the way the patient plans and initiates tasks. Second, the part of the brain that deals with attention causes difficulty in paying attention, working effectively and processing information when in a waking state. Thirdly, the part of the brain that uses memory and learning is also affected. Due to the disruption in daytime cognitive state, behavioral effects are also present. This includes moodiness, belligerence, as well as a decrease in attentiveness and drive. These effects become very hard to deal with, thus the development of depression may transpire. Finally, because there are many factors that could lead to some of the effects previously listed, some patients are not aware that they suffer from sleep apnea and are either misdiagnosed or just ignore the symptoms altogether. Sleep apnea treatment. Treatment often starts with behavioral therapy. For mild cases of sleep apnea, physicians often recommend sleeping on one side, which can prevent the tongue and palate from falling backwards in the throat and blocking the airway. Many patients are told to avoid alcohol, sleeping pills, and other sedatives, which can relax throat muscles, contributing to the collapse of the airway at night. CPAP, surgery, is the most consistently safe and effective treatment for obstructive sleep apnea, but it is not a cure. People are less likely to use it in the long term. Sleep apnea is a common disease, yet every individual needs unique treatment and care. We encourage people with sleep apnea and their families to learn, as much as possible, about the latest medical treatment and approaches, as well as healthy lifestyle choices. For more information about sleep apnea and how to treat sleep apnea, just click on the link at description or visit www.mainmd.com. Thank you.